For joining us today. Thank you for joining us today. Welcome to this webinar. We are very much excited to have you with us. Good morning, good afternoon, good evening, everyone, depending on where you're joining us from. It's a pleasure to have you here. Just some quick housekeeping before we go on. Like you may have seen, we'll be recording this session. Also there is oh, Maureen, you can't hear me. Okay, let's try that again. Robin, can you? Okay. So please, if you can't hear me, I think most can. If you can't hear me, can you kindly check your system again? Um, just to make sure everything is set up right. Because I think most people can hear me. Okay. So this webinar is available also in Spanish. We have Cynthia here who is helping us with the Spanish translation. At the bottom of your screen, you would have a tab or button. Kindly mute yourself, please. Thank you. At the bottom of your screen, there's a button or tab with the globe sign that has interpretation written there. I would like everyone to click on it. And if you're English speaking, click on English. And if you're Spanish speaking, click on Spanish. This would enable us, thanks for letting me know, Maureen. This will enable everyone here what's being said in the different languages at different times. Okay. Okay. Also, I'm going to say this again, but I'll say it now. We would start the presentation. So we would ask that you please keep your questions together, write down your questions, and at the end of the session, there'll be a session for questions and answers. You'll be able to ask any of us who would have spoken any concerns or questions you may have at the end of the presentation. So we will get right on it, and I will share my screen now. Please can you give me a thumbs up if you can see my screen and if you can still hear me. Thank you. So the title of our presentation is Unlocking Organizational Impact Through the NTD Inclusion Scorecard, which we're referring to as the NISC, Your Path to Inclusion and Participation. My name is Bernice Ejogu. I'm the From Words to Action project coordinator. I'll be doing this presentation alongside Robin van Wyk from Netherlands Leprosy Relief. She'll try to join us how she can because right now she's lost her voice, sadly. But we'll see how that goes. And I'm sure you can still ask questions that she'll be able to answer in the chat box. So her hands are working very well. So grateful for that. I'm sure we're familiar with this quote, nothing about us without us is for us. Is a famous quote. And the hope is that this quote serves as a reminder to all on the need to get to the point where, because of those who are primary focus or beneficiaries of the work of NTD organizations, who are the persons affected by NTDs, decisions that are made towards initiation or implementation of interventions or any work we want to see as impactful is done with meaningful and significant input from persons affected by NTD. One way of showing you how to ensure inclusion and participation of persons affected towards organizational impact is what we're going to be elaborating on today as we do this presentation. And this is the outline we are going to follow. First, we'll be introducing the NISC tool. We will then go through the key domains of assessment in this NISC tool. We would talk to you about how the assessment process goes. And then we have very lovely people who will be talking about promoting inclusion and participation and also sharing real world stories of success in using the NISC. They have participated in the pilot processes in different organizations, and they are very happy to share with you. After all of this, we will then have our Q&A session. So please, again, you can write the sessions in the questions in the chat box. You may also want to write them down if you want to ask verbally at the end of the presentation. So how did all this begin? Why are we here? How did this all start? In 2020, the group of NNN organizations adopted the Statement of Participation, which is to ensure that persons affected by NTDs have the space and support for meaningful and effective participation in the policies and decision-making processes of member organizations. This is also in tandem with the ILEP's EASI participation strategy of persons affected by NTDs. And in adopting this statement, there was the decision to take practical steps to make participation, inclusion and meaningful participation a reality, because up until then, it really wasn't. A lot of people talked about inclusion, a lot of people talked about meaningful participation, but what did it mean? And how would we as NTD organizations go about it? Thus, this statement, and this led to, this was championed by the Disease Management, Disability and Inclusion Working Group of the NNN, and to address participation, non-discrimination, and which is a cross-cutting group that addresses participation, non-discrimination, and accountability in NTD work. So after this statement was adopted, it led to the first draft of the NISC tool, which was an adaptation of the Disability Inclusion Scorecard. So this was a step towards ensuring that specific tangible work was done to pertaining inclusion. And this tool now adopted went through series of reviews and collaborative reviews by DMDI members, and also persons affected by NTDs, answering questions of what do we want to look like, what do we want to assess, how do we want to assess it, and all of that. And at the end of all those series of processes, one main draft was developed in 2022.
Your screen is not moving. Your slide.
Yeah, I'm not. Yeah.
Oh,
yeah.
Okay.
Thank you. Yeah. So, one main draft was developed, and that that led to the next stage of the process where I came on board as the project coordinator, of the project with the aim of getting a final draft, a final tool, a finalized tool, and which would be piloted in different organizations. So that first draft was reviewed, and the first phase of the project had pre-interviews where some of the key participants at the pilot organizations were interviewed about their expectations and what they thought about using such a tool. In the first phase, the tool was piloted in 5 organizations, after which we had post interviews and surveys of participants of the pilot, and data was analyzed, feedback gotten, and then we had another draft of the NISC, using feedback from the first bit of pilots that were done. In the second phase of the pilot, we went through the process again, but with different organizations this time, and went through another 5, got data and improved on the tool. By this time, the tool also needed improvements in its not just content this time, but the software. And the new software at this point was also tested in 2 organizations, and which led us to the final version of the NISC, and which was launched in Tanzania in September this year. So the organizations where this NISC was piloted include AMREF South Sudan, NLR Indonesia, CBM DRC, HANS Nigeria, NLR International Netherlands, TLM International Office UK, CBM Nigeria, TLM DRC, MALC Pakistan, SASSS India, IS Global, and NLR India. We'll be forever grateful to these organizations for taking their time and for their commitment to this project, and for contributing before, during, and after the pilot towards the success of the development of these tool. In the process of developing this tool, we also tried to clarify meanings of key concepts. We talked about what inclusion was, and this was agreed: facilitating equitable involvement of persons affected by NTDs in working environment. Inclusion will ensure that everyone is given the opportunity to add value and meaningfully participate, and their contribution is valued. The picture there is of a NISC pilot taking place in the Netherlands. We also came up with meaningful participation being where persons affected by NTDs are actively involved, their voices are heard, and their perspectives are considered in policy and decision-making regarding the design, implementation, and evaluation of initiatives in organizations. It's key that everybody understands where we're coming from. This is what we aim to achieve. And so it was very key coming to these definitions. So what is the NISC tool? The NISC tool is a self-assessment tool that supports organizations in assessing and enhancing their performance in critical areas related to the inclusion and meaningful participation of persons affected by NTDs, not just in implementation of activities or program activities, no, but in this case, in policy and decision-making processes. We want to start with them. And how does it do this? So the NISC assessment helps in initiating the discussion on inclusion. You get to sit down to talk about what inclusion means in your organization, where you want to see your organization go as with regards to inclusion. And it also broadens perspectives on inclusion. We found that some people have testified to having initially narrow views on what inclusion means, but after using the tool, these views have been broadened. The NISC helps you in doing that. The NISC also helps to identify inclusion gaps and challenges within your organization. And as you identify them, because of how it is set up, you're also able to get tangible solutions to fill in these gaps that you have identified. So that's what the NISC does. And we do it in over 7 domains. So we look at governance, inclusion in governance, we look at program management, um, where there are 4 questions. Governance has 3 questions. We look at it through the lens of human resources, which has 4 questions in the tool. We look at it through financial resources. We look at it in accessibility. We look at it in external relations and in communications. So in all, there are 21 questions you need to go through in the NISC. And this assessment can be done at different phases, as we call it. So there's the baseline phase, which is the first phase. I mean, the first time you get to do it as an organization, you'll be doing it at the baseline phase. The progress phase will be the next subsequent assessment you would have done. And in between these phases, we expect that you would have tried to put in corrections or plug the gaps that you have seen. You'd have tried to do some continuous quality improvement in terms of inclusion and meaningful participation of persons affected by NTDs within your organization, and then come back to assess yourself and say, okay, is there any improvement? Is there any way are we going in the right direction, basically? Based on what we've done, we recommend you do it like a year after. But it's not cast in stone. Your organization can decide how often you'd want to come back to this discussion on inclusion. And then you can get to do it at the third time you get to do will be the final phase. So depending on what you're testing at the beginning, you have the baseline, you have the middle ground where you want to see how far you've gone, and then a final phase. So the NISC has a scoring from 1 to 4. Number 4 indicates the highest. We use the highest score, which indicates that you have good in practice of inclusion and participation of persons affected by NTDs, while 1 is the lowest, which shows that there's a great room for improvements in your organization. However, you might think, I think we're doing well as an organization in inclusion, meaningful participation of persons affected by NTDs. If you're at that point, then we challenge you to think of what having a score of 5 will be, because we believe that there's always room for improvement. So ask that you take up this challenge and use the NISC tool and see where you're at. So like I said, we do this assessment over 7 domains, and there's a thinking behind doing it over these 7 domains, and there's always a benefit why you as an organization should go through the NISC and try to assess how you're doing with inclusion in all these aspects. We'll start with governance. So why assess inclusion in governance in your organization? Why is it necessary? So first, I would like to talk about accountability. Doing the NISC holds your organization accountable to your mission and serving the best interests of persons affected by NTD. It shows that you're transparent and that you're remaining transparent in your work. It shows that you're responsive. It shows that you're aligned to the needs of the community that you are serving. So that's why it is important to assess this. It also helps you in effective decision making and enhances impact through involvement in strategy setting. Why? Because you have different people, a wider range of perspectives on the table when you have persons affected sitting with you in decision-making processes or at the level of governance. It helps in building trust within these communities, within your target communities as well. It demonstrates you're committed to valuing their input, you're committed to valuing these very important stakeholders, and it helps in you're as an in your getting buy-in from the community members. It helps in them taking ownership of interventions of projects that you're bringing to their community, thus ensuring sustainability of your projects or your programs as it may be, or your interventions as it may be. An example of a question that we ask under governance is this: are persons affected by NTDs represented in the board or other decision making processes in your organization? And why do we ask this question? Asking these questions allows you to consider equity and fairness in governance. How do you ensure that the decision-making processes are accessible to a representative um, group of stakeholders? Meaning, I mean, are the persons affected who are your key stakeholders involved in this? So, how are you promoting equity and fairness in governance? So it helps you look at things in that light. So that's an example, one example of the questions we ask under governance for you to consider. In the second domain, project management, it is important to assess inclusion here because it should not, inclusion of persons should not be an afterthought. It shouldn't come after you've designed the program and gone to the field. Okay, let's hear what they have to say, kind of thing. No. So it should be thought of from the beginning. You should involve them in the design from concept, from initiating your concept notes. You should want to know what they think about it's what you're trying to provide is for their benefit. So they're most affected, and so they should have a say in what it brings to them. So if in doing that you have targeted and effective programs, um and better program outcomes as well. And this also enhances sustainability, enhances accountability, and ensures that you're doing a community-centered approach to your programs, which helps in increasing acceptability of your programs. So we can see that inclusion in program management is really crucial. Um, and as it ensures all of these things, which as an organization will be a plus for you. So the next domain that we'll look at is human resources in NTD organization. So why assess inclusion? Why discuss inclusion in HR? Yeah. So one benefit or one reason why it is very important that you do this is that it ensures that your organization recruits, retains, and promotes a diverse workforce. Um, which it reflects the community you serve is represented. And a diverse team already brings in a diverse range of perspectives. They bring in diverse ideas. They contribute to your program being very, very effective. Your organization would be seen to have representation, um, and it would this can also show compliance with certain legal requirements or obligations where you're supposed to have certain number of people in that are in a particular category within society. Okay. And also ensuring inclusion in HR would help create safe spaces and better employee well-being. Your organization will be seen as one where people can freely give their opinions on things, even if it's a critic, and it will be welcomed. They are safe to express themselves, and you'd have um a more positive impact on employees, and all of this also reduces attrition for you because your organization will be a very, I mean, when it comes to work environment, you would be known for that, a very good and positive work environment. And that would improve your organizational um, reputation. So we've talked about why it is important to assess inclusion in governance, why it is important for you as an organization to assess inclusion in program management, why it is important for you to assess inclusion in human resources within your organization. Now, why is it important to um, assess inclusion in finance? A lot of people are like, no, they don't have anything to do with this. But this is an eye opener also, or this has been an eye opener to many organizations, because again, it is important that you think of persons affected by NTDs from the beginning. Um, so this is another way for you to have them in mind at the beginning. You'll be able to ensure that they have equitable access to support, you'll be acting ethically responsible, and your donors will trust you more. So you'd a lot of times we don't see, okay, how do we promote we don't think of putting budget line items for things to do with persons affected by NTD, specifically if it's not so program related. But the NISC gives you an idea of how to do that. Let me show you one question that we look at when we're talking about finance. So this is a question in the NISC. It says, what budget allocation exists for compensation and remuneration for time and or expenses, also for remote participation dedicated by persons affected by NTD in participating in policy and decision-making processes and forums, including relevant conferences, thereby ensuring their meaningful and effective participation. So what's the thought behind this question? A lot of times we get persons affected involved in helping us make some decisions, but we do not necessarily compensate them for that. We have forums where we go to meet, conferences or meetings, we go to meet to talk about them or to talk about things that concern them, but we don't have them there. Why is that the case? Or at some point when we have them there, we do not really compensate them. Sometimes we give them transportation and all of that, but we don't really think about time, the time cost as for them. Oh, they're doing it voluntarily and all of that. So this is a call to actually show that they are valued, their contribution is valued, um, because they're making meaningful contributions to what we are doing. If we've not even gotten to that position where we involve them in conferences or meetings that are essential to them, it gives you the opportunity to think about that from the beginning when you're making budget line items. Oh, we need to provide for this. So that's what the NISC helps you to do. The next domain we'll be looking at is accessibility. So why access inclusion in accessibility NTDs? This helps you to promote dignity, it helps you to promote equity, you be seen as more inclusive. So you're thinking not just physical accessibility, which is the easy to go to resolution a lot of us take, but we also think about access in terms of remote access. When you're having meetings, do you consider them? Do you ensure that they have the right connectivity? Do you ensure that those needing various alternative forms of access, Braille and all of that, really have these access to this information or to these facilities within your organization? So it also helps access to, so access to information also results in effective communication and empowerment of the persons affected to contribute effectively. So when you make these provisions, you're in turn empowering persons affected to effectively contribute. as valuable members of society to your organizational processes. The next one is external relations. So why do we assess inclusion in external relations in NTD organization? So it helps you come up with contextually relevant messages. You'll be disseminating information and materials to a broader audience. So you need to ensure that this critical information about entities, about persons affected, that reaches and your organization's work reaches reaching key stakeholders are contextually correct. They really they consider the rights of persons affected as you're producing them. It also shows that your continued focus on the rights of these individuals, persons affected by entities, and it raises awareness on the work you are doing, which potentially gives you more funding and support for NTD organizations. So we've talked about 6 of the 7 domains. We had the 6 initially, but in the course of the development of NISC now, because we're making improvements based on feedback, and we realized, oh, this last domain is really, really important and key when it comes to inclusion, and that is the communications domain. So why assess inclusion in communications in NTD organizations? So it is very this this is a very important, well, all the domains are important, but this is also very important because it promotes dignity of persons affected. It helps you sit back to think, okay, how are we collecting and documenting our stories? How are we collecting and documenting our pictures? Are we doing it in a way that shows we respect and we value persons affected, or are we just presenting them as charitable cases, which shouldn't be the case, or as charitable objects, which shouldn't be the case? And making your communications inclusive also raises public awareness and reduces stigma of persons affected by entities. They are now looked at or seen as valuable members of society, and this in turn builds trust within the community of persons affected by NTDs. An example of a question we ask in the communications domain is this: does your organization present persons affected with respect and as individuals with inherent dignity and rights in your external communication? So how are your brochures developed? How are you, what do your flyers look like? Um, what do your fundraising materials look like? This can be very tricky and dicey in fundraising because we think, or the more, sometimes it's assumed that the more gory the pictures are, the more responsive donors will be to our campaigns. But we need to really remember the rights of persons affected um in whatever we're doing at NTD organizations. And this is one way we can really consider that and look at that. Our messages can be passed across and more effectively so when we involve them in production of this materials or get their consent in producing some of this material, some of these stories, and still have the same effect in even monetarily in our funding. Yeah. So these are the 7 domains that usually are considered in the NISC when you do the exercise. They're very interesting questions, and that you need to sit down and discuss and try to find where your organization is between the options 1 to 4. So what is the NISC assessment process like? The first thing I would like to tell everyone is the NISC is a group exercise. It's not just for an individual sitting down to fill the document. So it is a group exercise. So the group is made up of a unit of representatives within the organization. So every unit or every department in your organization must be represented there. And at least one person affected by NTD, because we're talking about inclusion here, they have to be there. So that will be a start. If you've not been doing anything with them, this will be a very good start for you. So units that are represented should be able to speak to all the domains in the NISC tool. We have the 7 domains, which I have just elaborated on. So representatives should be able to speak to them in responding to questions. And it takes an average of 3.5 hours to go through the NISC. And this has a lot to do also with the facilitator. You need somebody who can keep the discussion on track. Some people can get really excited and can veer off and all of that. So it's very good to have a facilitator that will keep the discussion on track. An external facilitator is recommended to have someone neutral moderating your discussion. Um, we're not saying you cannot use someone internally. No, it's possible to use an internal facilitator. We just recommend an external facilitator. So we're going to be going through a brief tour of what the NISC tool looks like right now. So the NISC is available on the info.ntd.org website. If you just type in this link, you should be able to get there. There are other resources available to enable you use the NISC effectively. You have the facilitator's guide. You have facilitation slides already there for you. So any facilitator will be able to look at it and easily um, uh, implement this, or be able to conduct this exercise with you in your organization. The NISC is available in 5 languages and all these other resources as well. We have English, Spanish, Hindi, and Portuguese. And in the near future, hopefully we would have a bank of best practices that you can easily have a look at to say, oh, can I do this to improve a gap that we've identified in our organization. So I'll stop sharing now so Robin can share her screen, and I'll just quickly take you through the NIST tool. After we come back from that demonstration, Jaya is available here. I can see her. She'll be talking to us from the perspective of persons affected, why you should be promoting inclusion and meaningful participation using this in your organization. And thereafter, we would hear real world stories from Leonardo, from Ringpan, and from Yvonne, who have participated um, throughout this process of developing the NISC. They'll be here to share with you the benefits and the impact of using the NISC tool. So right now I'll stop sharing, and Robin would share, and then I'll just show you what the NISC looks like now. All right. So when you've gone to Info NTD and you've clicked on the tool, you download the tool. This is what you see when you open the tool. There's the about page, and you have why this tool, for whom, how to use it. Then at the top there you can see the language button. There you get to choose what version of the tool you want. Do you want it in English and any of the other languages there? In the introduction tab, okay, you've just turned it to is it Spanish? Yeah, this is Spanish. Yeah. So in the introduction tab here, you have the user guidelines, which tells you like the format, what to do. You need a scribe, what steps you should take, and all of that. And the next tab, we have a tab that defines key concepts. So when you're going through the tool, what do you mean by meaningful participation? What do you mean by marginalized groups? What do you mean by inclusion and all of that? Yeah. And then when we go to general, yep. Can we have it English? Thank you. Okay. So here you have you can record what phase you're doing it in. You have the date, can put today's date. You have participants, you record the participants who are involved in the assessment at that time. And then yeah, you can choose what color you want and all of that. Then we move to domains. All right. So okay, start and then domains. And when you get to domains, you'd have you can see the 7 domains I just elaborated on. We have governance, project management, human resource, financial resource, accessibility, external relations, and communication. So you click on any of the tabs to get to the questions. Under governance, we have 3 questions. Under governance, we have 3 questions. And under each question, we have 4 options. So, like the first one says, do the strategic and operational documents support the rights of persons affected by NTDs in your organization? So you click one of the options. So Robin has clicked one there, or have you? Okay, 2. And then you might write a comment or a remark there in the comment. Yeah. And then if you have an action, if you can decide on an action there, you decide, okay, we need to do something to improve on a gap. Okay, we need to focus more on the rights of persons affected in strategic documents and all of that. You put it there in the action beside the action tab, yeah. And then so you do the same thing for all the questions, and then you do it across all the tabs, all the domains. So Robin, if you can please just move it to yeah, so we can see this is what HR looks like. This is what human resource, financial resources, please. Yeah, thank you. Accessibility, external relations, and communication. Yeah. So this is what it looks like. So, and after you've done all of this, you move to the next, which takes you to this graph. So here this is a graphical representation of how you've done. Okay, so you tick what phase you're in, and it gives you a representation of how you've done. When you come back to do progress, it shows you whether you've improved or not, and final, and and the likes. And after this, you can then print out a sheet. There's a button at the bottom that you can click, and MS document will now be generated, which would have all your comments that you've written and action points. And then you can open that up. So like you can see, this is what it says. So for each domain, it shows you what actions you've decided to take. And you can keep that as for future references, especially if you want to make an improvement project out of those action points for your organization. Is a very good resource. And then after this, you can also refer to the action plan toolkit, which will soon be available for best practices. Some organizations may have tried out something that may have worked. So you may not need to start from scratch with getting an idea to fix a gap you've identified in your organization. Okay, so this is the NTD inclusion scorecard on the info.ntd.com .org webpage. So here you have the downloads. You can see all the resources there available for you. All right. Thank you very much, Robin. So I would hand over to Jaya right now. Hi Jaya.
Hi,
Hi.
Vanessa.
Yeah. So can you give us a 1
Yeah.
minute introduction of yourself and then go ahead to answer the question?
I'm so sorry. You should tell me which question you will want me to answer before.
Why should you promote inclusion and meaningful participation? Yeah, that question. Yeah.
Yes. So good morning, good afternoon, good evening to everyone. I'm Jayashree. I'm a qualified accountant living in Bangalore, India. I'm a person affected by leprosy and cured long ago, about more than 3 decades ago. And I do work for the cause of leprosy. I'm on the board of several charities, and I keep doing this work. This Diwali festival happening in India, so everybody's bursting crackers outside, just like, letting you know there may be some interruptions. So thank you, Bernice. It was such a wonderful presentation, and thank you. I was involved in reviewing the NIC tool, and it was a great opportunity. And personally, because of the fact that the 7 aspects of what have been included in the document, the tool itself is amazing. So first thing was, many of the charities that I have either been part of the board or even otherwise involved with, I've seen that along the way, because there's nothing written in the governance aspect of, are the vision and mission of the organization, including, considering the requirements, or, having them, the people affected in the policy making, or in the strategy building, or in the, say, creating vision mission. Because of lack of that, sometimes many organizations lose track. And so it is all about, we have staff, so we need to do something. And so the attention then moves away from the core work. And this document talks about, clearly that you have some written policy of inclusion at the level of, say, governance. And then one can move, from you score yourselves 1 and it's a group work. So I just love the structuring of the tool. It's wonderful, because then every organization can have turn the eyeballs in and have look at where you are and move forward. So that was one amazing thing about the, one aspect I'm telling. And when it comes to finance, I have myself seen many capable people who have been affected and they don't have the economic, independence. So because there was no written policy about inclusion of people affected and, the aspect of finance, there was no budget allocation for people's participation, meaningful participation. Therefore, it was mostly, I've seen charities, smaller ones, scurrying to put together funds to, send somebody for a representation. So it becomes very much like a tokenism kind of a participation. So that is another aspect that I saw, that the tool allows for the organization to, look and review, and also then thereby create the, the required, say, budget for, the people affected to participate. And then when it comes to HR, likewise, the people's participation, they are included, they are actually, coming up with, so what kind of, inclusion would be there? It's not about just appointing somebody on the roll, that there is, you need to have participation, so have somebody. It's like, what is the progress a person would have? So I think that the relevant questions about, involvement, then they are engaged in the policies, etc. So that is another aspect which, is there. And in the program management, I found it very interesting. Like some of the aspects are about, do program create accessibility for people affected, and does, say, for example, collecting the and monitoring of data, and design and development, and the evaluation process of programs, plus capacity building opportunities for people affected. So I can see that people affected being part of, moving from where they are, and, getting included, especially when it comes to, say, the marginalized community groups, so you're actually involving them and involving them in the program development itself, because otherwise what the organization might think is a useful set of things to do might be actually removed from reality, because the people affected are in the ground level, right? They understand the program better, they know what they want, so involving them in program development will make the difference. I think these are some of the things that I felt are good. And I also like the fact that it's participative, everybody's involved, and you have scope for improvement. So there's nothing like a right and wrong thing. So that was another wonderful thing, that the scope to improve, scope to move forward. So yeah.
Thank you. Thank you very, very much, Jaya. Thank you very much for all of that. So like you've heard from Jaya, it is important to do this. So your organization stays focused on what they should stay focused. So focused on, not especially when it comes to including persons affected, the rights of them in your strategy documents. It's also important for your organization to go beyond tokenism participation of persons affected. So, like she said, and it also helps you have more focused programs because they understand better where it's pinching. So they'll be able to advise you on what they really, really need. Thank you very much. So we have Leonardo De La Torre. He's joining us from the airport. So Leonardo, are you with us? Yeah.
Yes. Thank you, Bernice. Thanks for everything. I don't know if you can hear me.
Yes, we can.
Yes. Blessings from the airport of Tarija, southern Bolivia. We are just in the move to activate some workshops in a participatory process in Chagas disease. Here we work with that. The tool has helped us. Yes, tell me.
Yeah, just wanted to say you can speak in Spanish if that would be better for you.
Really? Just like this?
Yes.
Well, I don't know. I can I trust you? Okay, I go. I hope not to lose anyone in the short translation. I'll keep in English. Just thank you very much for the option, just to make it easier for you. I hope to express myself well. I was telling the tool. The tool has helped us, has given us some worldwide perspective, some panorama in terms of the issues we are working with weekly at our organization. It means patients can be invited to the project level. They can really be their decisions can really turn out at the project level, but it doesn't happen at the institutional decision or governance at the institutional level. So inside the closed game of a project, we practitioners open access. We open the floor for persons, people affected decisions, and they can feel, and it is true, sometimes they can lead our project to one direction or the other. So their opinion is really taken in consideration, but it doesn't happen at the level of our decision making at the organization level. So there's a long trip. So it could happen, and our organization could really involve affected people, affected persons in their board or in the decision making for the project or the financial level. So it is only happening, participation is being truth, governance of the project is being truth at the project level. Another issue we have known, or we have used the experience of going through the tool has also make us aware of the project, of the problems that the problems we face are not only ours, that they are everywhere. We are in the middle of a workshop and we are paid by salary, and those people whose opinions we say are really important are not being paid for being there. They might be paid for transportation, they might be paid for food or facilities, but at sometimes we really demand from them a lot of workshops a lot of hours, and we don't open the floor for the possibility of paying their time. So if their opinion is so crucial, is the capital of the project, if it is the keystone of the process, but they are not paid and we are paid in the same workshop. And so this has helped us looking at the mirror. So I really think this, I only took these two examples, but in a general way, I believe it is great to know that somebody is taking it seriously at generating a tool that will help us and all the staffs that lead participatory process in neglected diseases wideware. So thank you very much for this, Bernice.
Thank you very much. So, NTD organizations, it's time to look in the mirror. The NISC is the new mirror, according to Leonardo, and it's a very good mirror. It helps you see good things that you need to change, and it also gives you ideas on how you can go about changing them. Thank you, Leonardo. So we'll be
Our
talking
pleasure.
yeah. So Rimpan is here from Hans. Rimpan, I saw a question pop up about what Hans is in Nigeria. So you might have to just give a brief introduction of yourself and what Hans does, and then you try to answer the question about the benefits and the impact so far on the use of NISC in your organization. Rimpan, are you here?
Okay, I'm here.
Okay.
Good afternoon. Good afternoon.
Good afternoon.
Sorry, I'm also in the field somewhere in Yobe State in Nigeria. So I just had to enter the car to participate in
Thank you.
the seminar. So HANS stands for Health and Development Support Program, HANS. So we are a local NGO in Nigeria. We support the control and elimination of neglected tropical diseases in 4 states in Nigeria, namely Yobe, Jigawa, Kano, and the Federal Capital Territory. We support the integrated control and elimination of NTDs, the 5 PC NTDs, which include onchocerciasis, lymphatic filariasis, trachoma, schistosomiasis, and soil-transmitted helminths. So basically, that is Health and Development Support Program. We were one of the organizations that participated in the piloting of the NICS tool, and then we partook in it as a team with representation from the different departments, the finance, the admin, the program, and then different aspects of the department, and then with persons affected by NTDs. They joined us. We got someone to join us from the state. So basically, that is how we work, and then that's how we partook in the development of the NICS tool. So how have we gone so far? As an organization, we have been having a lot of program that deals with inclusion of persons with disability. That is one of our core mandates, because initially the organization started as an arm of Christopher Blinded Mission, CBM, but the CBM International and CBM Global Disability Inclusion. So right from the first time we started work, emphasis had always been on the inclusion of persons with disability in every aspect of our program. So we have been doing that over the years. So when the NICS tool came up, it just became like something that we had been doing to some extent, and then just only try to expose how the level to which we had been doing inclusion program in our organization. So it was until we started completing the document that we now saw that it is beyond just inviting people and then using them for whatever purpose you want to use them for, just to show the world that you have included persons with disability. It was completion of this tool that led us to understand that the aspect of inclusion has to go with the process of governance, and then going down to participation, and then going down to beneficiaries. So it goes to show that in this inclusion, the people who are involved are the people who are benefiting part of the program. I think basically that's one of the core issues that we need to take here. So one thing that we do as an organization, presently I'm in Yobe State, we are carrying out training for mass administration of mectizan and albendazole for lymphatic filariasis and schizophrenia and onchocerciasis. That is what we're doing here. But then, how have we started involving this? We have been involving persons affected by NTD at all the levels of program implementation. Now, the aspect of governance, we have some challenges because you have to come to the point of recruitment of staff before you can talk about whether you will consider person affected by NTDs. So that is something that is beyond the scope of resources that are available. So that we may not be able to do unless we have such opportunities. But then for what we have currently, activity, either MMDP activities or mass drug administration activities. So what we have decided as an organization is that where we are implementing activities, we try to ensure that whatever activity we implement at all the levels of implementation, there is participation of person affected by NTD / person affected by disability. Like I told you earlier, as an organization that promotes inclusion. So basically, we try ensuring that they partake in the activity from the planning stage to the training stage to the implementation stage. So one thing we usually do is that we usually recruit persons from the communities, which include community directed distributors and even case finders to search for cases. So one thing that we have done after the whole of these processes is that we try to make it open for persons who are interested in serving as volunteers, to make persons who are affected by NTD, persons who are affected by disability, make it open to everybody so that those who are willing to participate can participate freely without any restriction. So we are seeing people showing interest. In fact, in the past, we were thinking that, will they be able to do it? And then so by our own intuition, we just feel they cannot be able to do it. So we just push them away by our own thinking. So, but then from the way we started, it became very obvious that what we feel people are not capable of doing, we saw clearly that they have the capacity. And we saw also that people who are having various disability due to NTDs, they are intelligent as well. Just that fate had it on some that couldn't attend school at different levels. So those are some of the things that we are seeing. Like one of the projects we have in one of the states, like the Chiskula project, which Maureen manages. When you see it well, you will see that those affected by NTDs are participating right from the point of planning, right from the point of implementation. And then when you see the way they are showing zeal and enthusiasm in the whole thing, it actually sends you a lot of message to show that you cannot just look down on somebody just because you feel he can't do it. But then if you give that person an opportunity, you'll be able to see more better results from the work that you are doing. So what is actually constraining us is the issues of budget challenge, because we initially had a budget at the beginning of the year, which already had the indicators, the number of persons that you are supposed to target. But then when we now completed this tool, it became obvious that we had to look inward. Looking inward in the sense that checking the available budget, can we be able to look for any space that we can include persons like this at each of these phases of implementation? So that quite raised the budget ceiling, but then we had to just look and then see where we can actually get some leverage to be able to capture those persons. So, and I think it is something that when you start doing it, that is when you will discover, well, nobody is supposed to actually be left behind. Because for us to implement and eliminate NTD, everybody must come on board so that we can be able to really eliminate the disease. Like for the trachoma tracheasis surgery that we do, one of the things that became very obvious for us is that if you don't bring those who were operated to now talk to those who are yet to be operated, those who are yet to be operated may have their fears. They feel that the surgery may not be safe. They feel they may not be able to see again, and a lot of apprehensions. But on using their members who had benefited from the surgery and are living okay to now serve as ambassadors, to serve as part of the case finders, that aided in actually bringing more trust to the program. And then you look at the issues of hydrocele, surgery, and even those with lymphedema. When you bring persons that were beneficiaries of hydrocelectomy, you will be surprised to see the number of people showing willingness to take up surgery. A lot of the people have different thinking, different mindset about the whole thing. But as soon as they see somebody who was operated upon, how it has changed his life, how it has improved his life, you will see more taking up that challenge to get operated. So we are seeing a lot of interesting things as we move to the field. And then we are seeing that we're also trying to adjust our communication strategies to see that, because most of these people are not educated. So we try to come down to the language that is general. Even in a planning meeting that we should be speaking English, you will see us coming down to use the local language so that all interest, everyone around will be able to hear what we are saying. So by so doing, we're able to have a more robust program that is inclusive and that is accessible for everyone. So, and then from the lessons that we've picked, if we are able to go forth to write anything, any proposal that has to do with mobility issues, we will see how to allocate resources properly for different levels, because we know that this inclusion, when you are paying people transportation, for those affected, there could even need for people that would assist them to come for those activities. So we must be able to budget in such a way that you capture those interests, so that if I need, yes, so basically that's the summary I can give. Thank you.
Thank you so much. Yeah. Thank you. No, it's really interesting to see how much of an impact it has made in your organization, especially with programming now. We can see how it has influenced your decision in bringing more of the persons affected in the whole program planning and everything. And it is one key thing I took from there is that it is not good to just assume that they cannot do it. A lot of times we're like, oh, these people are not this educated and all of that, but it's not just easy. I mean, we shouldn't write them off. We should try and bring them in and if necessary build their capacity where they're lacking. And thank you so much. Yvonne is next. She'll be talking to us she's the CEO of TLM in DRC. She'll be talking about the benefits and impact of using the NISC tool. Yvonne? Hello, Yvonne.
I am unmuting myself.
Okay, thank you. Over to you. Yeah.
Sorry. Yeah, hello everyone. Thank you all, Bernice, Robin, and the others who have prepared for this time of sharing. I'm going to speak a little bit about our experience in the DRC. We are TLM Congo. The leprosy mission is a global fellowship Christian organization leading the fight against leprosy. And we seek the transformation of people who are affected by breaking the chains of leprosy, tackling all the causes and also the consequences of leprosy in the communities that are affected. In the DRC, we are present in 5 provinces, and I'm now speaking from Kinshasa, the capital city of DRC. Like my other colleagues, we were participants in the NISC project, and we also navigated the 7 domains of the NISC, Together we brought together the heads of the key departments of our organization. That included myself as the country leader, and also the head of finance, the head of the HR, the person in charge of programs. But also we joined with the leaders of the Association of People Affected by Leprosy. Two of them were with us. That was during the pilot phase. And the process itself, as someone said, it was really for us the first experience where we were able to speak to ourselves, mirror ourselves against the different domains that are in the tool. It was a very challenging experience, I would say, because there are many things that we write on paper that, you know, people are included. We associate them in some of our programs, our activities, and so on. But when you look at it deeper, especially with regard to written documents, how do we express that inclusion in our documents, starting from the policy documents for us, for example? That's when we really saw that we still had a lot of gaps, and we needed a lot of improvements. But what was good with it was that we were very, very transparent with ourselves. And since we had people affected with us, we really looked at everything we do from the governance perspective, communication, programs, HR, and etc. We looked at it with the people who are affected. We asked questions face to face, and I think the scores that we were able to give were, I think they were quite a true picture of who we are. And I think unless we are able to go through that kind of self-mirroring, I think sometimes we take many things for granted. We think we are actually bringing people affected in whatever we do, and yet it is very, very superficial. We just call them when we have an activity, but from the start, during the process of developing the plans and so on, we actually don't make it deliberate, intentional that we bring them on board when we are developing some of these plans and program documents. And for us, that was a very, very good exercise. And for the moment, we have rolled the tool through our different sites. In the different sites where we work, we were able to download the tool and shared it with our project staff, such that each staff, each site where we work, project site, they are able to go through the same exercise and see that in every aspect of our work, at every level, we are able to intentionally include the people who are affected by leprosy. And we are now feeling that, you know, our organization can be a safe place where people really address issues of NTDs and etc. in a very transparent way, whether it is when we are budgeting, when we are planning, when we are organizing webinars like this one. This one was in English, so somebody was saying the language is very important, so they were not able, for example, to be with us at this webinar because none of them speaks English. So we need to take care of that. I understand there will be another session in French at some point where some of them will be able to participate. But I think we need to be very mindful whenever we plan that we consider the language. As someone said, most of our colleagues, our friends, most of them didn't go far in school, and communication is key, to any collaboration, any partnership. It's communication. If they can't speak the language we use when we are planning, it becomes a big problem. So we need to be very flexible, sometimes even using our local languages when we are planning, such that we enable them also to be active in whatever we do, and also be accountable, both of us, to any outcome from the work that we are doing. So from our part in the DRC, and from me as the leader of an organization working with people affected, I think having the leader herself or himself, take on this tool personally as someone representing an organization is very key. Otherwise, it will not be implemented. Once you understand it, you can then take the others who work with you on board, such that anything that you do, you have the responsibility to remind everyone that, look, there is this, we need really to be intentional as we are planning, that those who are affected are part of us. Yeah, so that's a very short summary that I can give. We have the tool in French for us, but we try as much as possible to also use it in other local languages when it is required. Yeah, so thank you, Bernice. I think you gave me 5 minutes.
Thank you very much. Thank you very much. Communication is very important. Yeah, and it is also very important that organization, for buy-in, it is important that the heads of organization are involved in this, the use of the NISC, so that there's a show of organizational buy-in, and then also for implementing changes that will come about as a result of using the NISC. Thank you very much, everyone. It's been a pleasure. Now it is time for more. I've seen there are loads of questions and some already been answered on the chat. But we'll now take other questions. So if there's anyone that wants to use the mic, you can ask myself, you can ask Yvonne, you can ask Leonardo, Ringpan, Jaya, Robin, any of us. Yeah. Anyone?
In my case, Bernice, it was only a thank you. I was just forgetting to thank all your support, especially Matthias, Jack, who conducted our session in Spanish calmly and patiently. So it helped a lot. I just wanted to point to that. That's it.
Thank you, Leonardo. Yeah. Any other person?
Yes, hello everyone.
Hello.
Okay, I'm Emmanuel Guyan-Zeze from Liberia, from the Futures Project led by the Ministry of Health in Liberia. Now, I really enjoyed the session where we talking about the inclusions of persons affected. It is a similar thing that my project is doing in Liberia here, where in every aspect, from the formative phase to intervention phase, we have persons affected in everything. If you can see my video here, it's a tablet we use. I'm a person affected, and I was trained to this, where that had the red cap on it, where we go and do patient survey. We do health worker survey and health facility ledgers, where we view cases in NTD's ledgers to know as to how many cases have been surfaced. And our project also has community advisory board, which of course persons affected have been prioritized in all angles. Where we got one person affected, we also have traditional healers, we also have faith healers, because we know NTDs is associated with belief. And with that belief, some of them don't go to formal health seeking, they prefer to go informal. That is the traditional healer and the faith healers. So our organizations have those categories of people. That is a community advisory board. We have 15 members, and we also have a peer support group in 3 counties in Liberia, namely Margibi, Lofa, and Grangide. That is the 3 counties that our project is in. But there is a plan that I have as a persons affected on my project. Just in case if my project is ending, we are planning of getting support, or we are anticipating for support to have a persons affected associations. That is a caveat to all NGOs that work around NTDs to have a persons affected association first before having NGOs or creating a network for persons affected in area NGOs or in area countries that NGOs around NTDs are working. So it will have inclusions of persons affected network or inclusions of persons affected associations. That is a roadmap of eliminating NTDs globally. So again, I'm from Liberia for Redress Project led by the Ministry of Health in Liberia. I'm indeed pleased to be opportune to have take part in this session today. Pleasure
Thank
being
you.
with you.
Thank you very much. Yeah. So can we take any other questions? And also I'll just quickly like to put in that there'll be a link shortly just for feedback on how we're doing or how we did today. Would like to hear from you what you think on how we did today. Okay. Any other question, please? Nobody? We're all good? Okay. So so there's a link now on the chat on this webinar. Would like to hear how we're doing or how we've done, and if we've answered all your questions. So if you need further information, like if you want to do the NISC assessment in your organization, please feel free to reach out to me and or Robin. We can facilitate it for free in your organization between now and January 31st. So feel free if you want to get us to run it in your organization. We're able to do it. We can do it virtually. It can also be done well physically if you want to do it physically with a different facilitator. But if you need clarification on anything, just feel free to send us emails. You can our emails are on the invite, and I'm sure we can easily pop our emails in here at the chat as well. So if there's anything you want, you need from us, just give us a shout. For some of you, I think I saw somebody saying something about resources on inclusion practices. We will be reaching out to you. We're trying to compile best practices as well of places where some of these activities or steps have been taken towards inclusion already, and want to see how you've done it. A lot of evidence in the past have been anecdotal. We want to see real evidence that other people can take and use, just adapt to their own context. Okay, so
Hi, Bernice.
hi.
Hi, Bernice.
Hi.
Yes, for us who have done, could we consider the pilot phase as baseline?
Yes, yes. For those who have yes, you can consider it as baseline. And I know some of you have already taken steps towards improvement, so you can give yourself a timeline of when to come back and okay, let's see how we're doing again.
Okay, so like after 1 year, we can still do
it. Yeah.
Yeah, an evaluation. Would you be willing to be with us during that time, Robin? Also, any facilitation support? Robin?
Yeah. Robin is nodding her head as in yes. So she's saying thumbs up. So
yeah. Thanks.
All right. So thank you, everyone. It's been a pleasure having all of you around. Thank you for making this happen as well. Please let us know what you think about this session using the link. And we'll be reaching out for resources on best practices in the nearest future. Thank you and have a very good rest of the day where you are.
Thank you so much.
Thank you.
Very
Thank
much.
you.
Thank
Thank you
you.
so much, Bernice.
Thank you. Thank you,
Thank you
Rimpan.
all.
Thank you,
Yeah.
Mark. Thank you, Leonardo. Yeah.
Thank you very much.
Thank you, Jaya. Yeah, thank you. Bye.
Thank you, Robin. Thank you.
Thanks, Cynthia.
Okay. Bye-bye.
Bye. Oh yeah. The French webinar will be on the 27th of November. Forgot to mention that. Yeah, but we've sent out some invites towards that and we'll still send out some more. Okay.